Three questions to ask your doctor in an acute concussion visit. So you just had the injury. You were just on the field playing a sport in a car accident, tripped down the stairs, a TV fell on your head, something happened, and you're in the doctor for your first session to evaluate this concussion to see if it is a concussion, what to do about it, that sort of thing. And I wanted to kind of frame this as a video or a resource to have so that you have these questions kind of in your pocket so that when this situation arises, if it arises, you can help yourself out, a friend out, a family member out to get the best care possible right away. These are questions I tried to think about, like, what would I want if my brother, he's not in the same state anyway, and he is a healthcare provider, but let's say my brother was in a car accident, my brother had a fall or was doing something, because he's kind of adventurous, he was doing something where he thought he was concussed, but I'm in Arizona, let's say he was like in Maine, and he's like, what should I ask my doctor? These are kind of the things that I would say, hey, go into the visit knowing that you should ask about these. So that's where we're going to start. Three questions is how would you differentiate this from whiplash? Who is your go-to referral for exercise testing, for visual vestibular testing, and for cervical spine testing? And then what can I start doing today? Now let's break down why those three are really, really important. Starting with the first one is concussion versus whiplash. How do you know? You're not saying, how do you know? I could give you really snarky questions to ask your doctor. How many concussions have you managed versus just saying go away? But no, so how do you know this is concussion versus whiplash? It's important because, again, referencing my notes over here so that I stay on track. Concussion and whiplash have identical symptoms. If you had patient A and patient B and you just had their symptoms listed out here, you'd be a liar if you could tell me who was a concussion and who was a whiplash patient just off of symptoms alone. They look identical. They overlap very well. And the thing to note is that all concussion has whiplash, but not all whiplash comes with concussion. When we look at the linear G forces for concussion, it happens somewhere between, there's not a definitive threshold, but somewhere between 70 and 160 Gs of force. So 1 G just sitting here, 70 to 160 Gs of acceleration, deceleration have to go to my head some way to shake my brain around, to stretch it and concuss it. To cause a cervical strain or sprain injury, a whiplash injury, that only takes about 5 Gs. So on your way to 70 to 160, you blew past 5 and you gave yourself whiplash. So if you had concussion, you also had whiplash, but it's not the same going the other way. If you hit 5 Gs, you might have all the symptoms of concussion, but you didn't reach that neurometabolic threshold. So how are you differentiating this? And the reason it's important is because a whiplash disorder is an orthopedic, or a whiplash disorder, a cervical strain, a sprain up here in the cervical spine. It's an orthopedic injury and it can be rehabbed kind of just right away. Just start doing things for soft tissue, manual therapy, corrective exercise to get rid of those symptoms rather than waiting weeks and weeks and weeks and wonder, why is my vision still blurry? Why do I still have headaches? That sort of thing. So it's something to kind of keep in mind. And the way that I would differentiate it in office is to think about, for both concussion and whiplash, you have to have the symptoms. You have to have a mechanism of injury. There's usually something jarring and traumatic that happened. We can do a vestibular oculomotor screening, and you might have symptoms in both cases, but where we're going to differentiate is that concussion almost always in the acute stages has exercise intolerance, early exercise intolerance, whereas whiplash maybe has late exercise intolerance, meaning you can get past 70%, maybe even 80% of your heart rate max, but you have symptoms 2 or 4 hours after the exercise, usually because the neck and the visual and vestibular system can't quite compensate for that long. And so in a concussion versus whiplash, concussion is going to have that early exercise intolerance, and it's going to change your treatment plan. And so that's why you want to ask that is, how are you differentiating this from whiplash? Because I know if it's whiplash, there's stuff that I can do. And I know if there's concussion, there's stuff that I should do, but it's a little bit different and it matters. So the second question that kind of ties off of that is, who are your go-to referrals? A lot of times primary care doctors and general practitioners and hospitalists and people that you see in the first stages of concussion, they're unfortunately, and it's not their fault, I don't think it's bad intentions, they're just going to tell you to rest or wait it out for 2 to 4 weeks. Yeah, just go home, take it easy, let your brain kind of recover, rest. Some docs are still saying avoid sounds, avoid lights, avoid, just hibernate. And that's the opposite of what you want to do. But it's still what's out there is they're just going to say, hey, go rest. So one thing you can kind of jump the gun on and kind of get the conversation going is, hey, who's your referral for exercise testing? Who's your referral for visual vestibular testing? Who's your referral for that cervical spine rehab for the whiplash component? Early aerobic exercise can reduce your risk of post-concussion by about 48%. And so we don't want to miss that. So ask for a referral for a Buffalo concussion treadmill test or a Buffalo concussion bike test. Who does that? For the cervical spine or the whiplash component. This can improve the headaches, the dizziness, the blurry vision, the brain fog, the fatigue, balance issues, all of those symptoms associated with whiplash and concussion. And so usually this is going to be a physical therapist, a chiropractor, maybe an osteopathic physician, someone in that kind of physical medicine realm. It could be an ND. I'm one of the oddballs there. Then you're also going to look for visual vestibular testing. And a good overlap clinician here is going to be a PT, a physical therapist. They're often the folks that are certified as vestibular therapists and also have the manual therapy and corrective exercise background to handle the cervical spine and the visual vestibular systems. So you want to ask, who do you have in your reference world, in your network, that you can send me to for exercise testing, for visual vestibular testing, and for cervical spine testing and rehab, because that's kind of the bulk of your concussion recovery. And then the last thing that I'll kind of wrap up here for the last couple minutes is, what can I do today? That's something I would ask is, okay, so cool, we think I have a concussion. We know that it's concussion and not whiplash because you already talked about that. We've got some referrals set up because I asked you about that. So what can I start doing today? And sorry, vitamin C, thinking about how I want to lay this out. What we can start doing today, what I always have people start doing is 5-5 paced breathing. So it's an inhale for 5 seconds, an exhale for 5 seconds. It's not a huge breath. It's just a normal breath. And we'll do that for, if we can tolerate it, we'll do that for 10 to 20 minutes twice a day. Ideally, at least once, 10 minutes before bed. It's a very low risk, high yield kind of intervention that you can start at any time during concussion recovery. And the reason I pause there is because depending on when you go into the doctor, today gives you different things. At any point, you can do the 5-5 paced breathing. But let's say that you went in within 24 hours of the injury. You got in a car accident yesterday, you're at the doctor today. You want a relative rest period of 24 to 48 hours. Meaning that if you were in the car accident yesterday and you saw me today, I would say, hey, I want you to take it easy. That doesn't mean you have to close the curtains. It doesn't mean you have to shut off the lights. It doesn't mean you wear sunglasses inside. It doesn't mean you avoid the TV. It doesn't mean you avoid books. It doesn't mean you avoid life. It means you just take it easy. We still want you exposed to sounds. We still want you exposed to lights. We still want you doing things, but very easy. Take a sick day, right? Just take it easy. You want to do that for 24 to 48 hours, but by 72 hours, so by day 3, you want to begin symptom-limited activity, which means by day 3, I want you walking around. Take the dog for a walk. Do the dishes. Read a book. Do some more normal activities of daily living. Some more things you would have done normally, but within a symptom-limited threshold, meaning if you think about your condition and your symptoms from 0, meaning I feel perfect, to 10, I feel like a dumpster fire, take inventory. Maybe it's acute, you're kind of a 5, you're in the middle. It's not a complete dumpster fire, but it's nowhere near good. I feel pretty bad. I still want you to do whatever, but don't go to a 7. So don't go more than 2 points in any activity you're doing. So you go to walk the dog, you go from a 5 to a 6, that's totally fine. It's normal to flirt with symptoms during concussion recovery. We just don't want to overdo it. So try to keep it 2 points or less starting at day 3, symptom limited activity. And then you want that referral in your back pocket. So you get exercise testing by day 5 to 7, earlier the better. Not too early, which is why we say day 5 to 7, but earlier the better. So what can you do today? It depends. 24 to 48 hours, take it easy, take a sick day. Don't hibernate, but just kind of relax. Day 3, I want you doing day 3 and beyond at any point, day 3 to month 3 to year 3. If you're all the way there in post-concussion world, we're doing symptom limited activity. And then depending on where you're at, day 5, 7, or beyond, month 5, year 7, we're doing exercise testing. And that's what we can do today. Beyond that, we're doing paced breathing. There's some nutritional things. There's different things we can do. But just to kind of put you on in a context of, there's things we should do and they should start soon. So the 3 questions that I would have my brother keep in his pocket would be, how are you differentiating this from whiplash? Because it changes the treatment, usually just in terms of what we're doing for the autonomic system and nutritionally and metabolically. Who are your go-to referrals for exercise, for the cervical spine, for the visual vestibular system, and what can I start doing today? And just for your own reference, remember today, if it's really acute within 2 days of the injury, take it easy. By day 3 and beyond, start doing symptom limited activity. And if it's after a week of your injury, or it's within the kind of the end of that first week of your injury, or anytime after that, you want to have exercise testing as soon as possible. So if you have any questions,